This is a disclaimer. I'm a hiker. I'm a former runner. I've run marathons. I've run 10,000 meter races all over the world. I've run hundreds of 10,000 meters. I've had every leg issue you could find, from having knee surgeries to plantar fasciitis to heel pad syndrome to shin splints. I've had all these. I've had cures for all of them. These are the methods that I found work for me. And I hope they work for you. But like I said, this is a disclaimer. I'm not a doctor. I've just found that these work. Hey, Medicine Man here. Three things I want to talk about: shin splints, plantar fasciitis, and heel pad syndrome. Three of the biggest injuries that you're going to get on trail, and if you don't treat it right and properly, you suffer with them for weeks. There's ways to prevent shin splints or reduce it. There's ways to alleviate plantar fasciitis pain, and there's ways to alleviate heel pad syndrome. And there's a difference between plantar fasciitis and heel pad syndrome. And okay, for shin splints are from here to here, and they happen when you have tearing of viscous material between the muscle and the bone, or between muscle and muscle, but primarily muscle and bone from here to here. Most people get them here or here. This is usually a fast injury. This is usually a slower injury. To reduce that, or to eliminate it altogether, there's one exercise that you can do. Literally, you take this toe to this knee. In other words, the right toe to the right knee, and you pick your toe up. And you take this toe and you turn it here. What you're doing is you're flexing this whole section of muscle. Basic running and basic walking don't exercise these muscles. They get weak. They atrophy. When they atrophy, they're prone to injury, which is the shin. You want to exercise these muscles. Taking this toe to this knee, what that does, it takes these muscles and flexes them, and it strengthens them. If you look, I got a fairly large muscle here. I forget the name of it. I can look it up. You can too. But this muscle being strong prevents all that micro tearing, all that tearing that you get. The thing about shin splints, if you get shin splints, there's all kinds of stuff you can buy. Compression socks, ace bandages, cling wrap, all kinds of gimmicks, right? Do they work? Yeah. Compression sleeves, ankle to knee compression sleeves, if you get shin splints, are great. And I would suggest that you have a ready address to get one of those if you get really bad shin splints. The best thing to do, though, is just this. 3 times a day, you go 30 seconds, and I'll rest for 15 seconds. You go 30 seconds again, you go rest for 15. And then you go another 30 seconds. You do that 3 times, morning and in the night. So you do 2 sets of 3. Okay? I got this exercise technique when I was marathoning. I was well into my marathons, and I kept getting shin splints, and I kept getting the ankle sleeves, or ankle to knee sleeves. What I used to do was cut off a pair of men's dress socks and put them on, because they didn't have knee sleeves back then. If you get shin splints, you have to massage it out every night. What I would do is get a little thing of Tiger Balm. If you don't have Tiger Balm, that's fine. You get a little tiny dab of Neosporin and put it on here. It's not for the Neosporin effects, it's so you can move your legs, so you have some lubrication when you're massaging out your shin splints. And yes, it's kind of important to massage your shin splints out when you get them. Mainly it promotes healing a little bit. It's a muscle, so muscles don't take a lot of massage, doesn't require a lot of massage. So just a few minutes, keeping it clean. Here's the edge of the bone, just right into there. And it's going to be painful, but you want to massage it out because you get some of the swelling down, and you promote some blood flow, and you heal it off. Okay. This exercise, if you do it religiously, if you look, you can see the muscles fairly pronounced here. If you can do that and you got a muscle that pronounces here a lot, and this is fairly strong, if you do a lot of hill climbing, a lot of hill running, stuff like this, you'll have this, and it'll be okay. And you probably won't have the shin splint problem. If you do get the shin splints, you get a sleeve, a calf sleeve, and yeah, they work good. Massage it out. Make sure you massage it every night. Every time you stop, just massage the swelling down a little bit. Is it going to hurt? yeah, it's going to hurt because you just tore a bunch of muscle tissue, and that muscle tissue needs to get uh, it needs to get healed. And that's the best way to do it. The best way I found. 25 marathons, running with some of the best in the business, and this is what we did. We talked about shin splints and the basic exercise to fix that. I can't tell you how successful it is. I've trained hundreds and hundreds of marathoners over the years, back when I was younger and had black hair. The shin splint exercise works. It really does work. We want to talk about plantar fasciitis and heel pad syndrome. There's a difference. Plantar fasciitis is the plantar fascia is irritated. That's the tendon from the front of the heel to the balls of your feet. There's two of them, a big one on the inside, a smaller one on the outside. Either one of them can be irritated. That's plantar fasciitis. Okay? Plantar fasciitis, it's a swelling. You have to have strong feet to be able to hike. Most of us don't. Most of us long distance hikers, even when we start out, our feet sometimes aren't in the best shape. And if it gets irritated, it usually stays irritated. In other words, it hurts all the time for a long damn time. One thing you got to do is you have to massage it. You have to massage it out. And that's 20 minutes every morning. The reason why it's 20 minutes, it's a tendon. Tendons take longer. Now, the tendons run the length of your foot, right? So you're going to want to massage your foot the length of your foot. Wherever your irritation happens to be, on the outside, on the inside, and near the ball of your foot, near the back of your foot, which is very common, right? You want to massage that in. Every morning you get up, 20 minutes on this. I'm serious. If you got both feet, okay, that's 40 minutes sitting in your tent, rubbing out your feet. It's going to hurt, and it's going to go away. Once it goes away, that means you've got a lot of the swelling down. A lot of the swelling goes down. Your foot's going to be a lot more pliable. It's warmed up. It's ready to start walking. And when you start walking with less irritation, it's going to be better for your foot. You're not going to be compensating and making other parts of your body ache because you're limping on one or both feet. This massage from wherever the thing is, 20 minutes. Nice spots of Neosporin on your thumbs, just to add some lubrication to your feet, so so it doesn't stick and start rubbing raw. Do that. Okay. There's taping methods too. I might get into that, but your biggest benefit for plantar fasciitis is rub these things out. One of the things everybody gets a golf ball, little cork ball they carry, and they spend like 20 bucks on them. Who likes avocados? Avocados really are great on the trail. Huge calories, lots of vitamins, lots of good fats. But for the benefit of what we're trying to do, it gives you a really big pit. Takes the place of the golf ball, takes the place of the little cork ball, and you can throw it away when you're done with it and not worry about it. If you need it in a pinch, if you need something to rub down your plantar fasciitis in a pinch, avocado pit. Clean it and dry it, of course. And it works great. You can work it all in. It works everywhere you're going to need it. On the anterior, this helps a lot. It's the size you need. It stays. If you ever need another one, you get another avocado for $3. Throw this away when you don't need it. One of the things people confuse a lot, you have plantar fasciitis to the center of the heel, and then you have something called heel pad syndrome. People mistake it for heel spurs and for a dozen other things that a bona fide doctor should diagnose. But one of the real common things is heel pad syndrome and plantar fasciitis. A lot of times they're confused on the trail. Plantar fasciitis will, as you're walking, go away. It will get more flexible. It'll get warmed up. It will. Heel pad syndrome does not go away. It starts out hurting and it gets worse and worse and worse. Generally, it's because you got the fatty deposits on the heel is being crushed and diminished, and you're slamming down onto the bone, the calcaneus, the big heel bone here. You're slamming down on that bone all the time without a good fat pad there. I suffer from this, and it's something that I have to deal with now. Never did, but yeah, PCT gave it to me. There's ways to tape it, and I'll show you in a second, but there's ways to tape it to reform your heel, to keep your heel in a nice good cup where it's held. Taping up for heel pad syndrome, I found this is the best method I've found. You might find a better method somewhere else, but this works for me. It will also work for plantar fasciitis that's in the back towards the heel up here. It'll also work for that. But what you do is you need a tape, and Leukotape is the tape to get. You got to have an anchor tape that goes around the back of the heel. You are not pulling hard. You're not putting a lot of tension. You're just putting a little bit of tension. Little tiny bit. Like I said, it's an anchor. And it's an anchor for these other tapes that I'm going to use. This tape is right here. Now, because the heel pad syndrome pushes here, I want to try to get this as rounded as I can. Okay, so I'll set it on one side in the middle, and I'll push down there and up. And that's one. Do that twice, and this is where pull tight, not super tight, but tight. This is where nice good pressure here will help for plantar fasciitis towards the back of the heel, but it'll help the heel pad syndrome a lot. Then you put another piece of tape for heel pad syndrome here, and you're pushing it at 45 degrees angle. And this one's tighter, the tightest of them all, because you're trying to push that fat of your heel in, and you go. Anybody who saw me hiking last year, they saw this get up in my sandals all the time. This works. This keeps the fat pad in place, if you will, or gives you a little bit more cushion. Doesn't eliminate pain, but it makes it a lot more bearable. This for plantar heel pad syndrome. This for plantar fasciitis. Again, if you have a problem that you think is not this or plantar fasciitis, get to a doctor. Especially if it doesn't go away. To the point where I can't take another step with my foot. My foot hurts so much I got to get off it. By that time, you're already well beyond a simple fix for your foot. It's going to take a long time to fix. A couple of weeks, couple of months. If you have a problem, your foot starts aching, it's not going to go away because you hike farther. It might go numb, but it's not going away. Stop. Get off your feet. Elevate them. Rub them out. Massage them. Use the avocado pit to rub it out. Some painkillers, over-the-counter painkillers. I had some ointment, some painkiller ointment, analgesic ointments that I used. Use that. I suggest if you think you're going to have a real problem, go to your doctor. Ask for an analgesic ointment of some type. Say, hey, if I've got a topical problem and I want to rub this in and get it to where the pain's gone, not so you can keep hiking, but so you can maybe get a good night's rest. See if you can get that. Bring it with you. Anyway, watch your feet problems. Watch your shin splints. You can prevent shin splints by that exercise. You can prevent plantar fasciitis by exercising, by getting a pair of shoes that you're very comfortable with. One of the problems is people get new shoes, hike on, and the shoes don't fit, and they have nothing but miles to go before they can get rid of them. That just causes problems. If you're going to get a pair of shoes, get them now. Walk in them every day, all day, for 6 months. Use those same shoes for the first 50 miles. Then change your shoes to the same type of shoe. That way your feet are going to be used to what you got. You're not going to have these all brand new things that are going to probably cause you problems. Very few people can get a brand new pair of shoes and not have issues, or a brand new type of shoes and not have issues. Really suggest you get your hiking shoes now and go. Anyway, hike well, be well, and live life, man.